Hi, my name is Dr. Glen Davies. I'm a clinical child psychologist, and for the last 30 years I've been working in the field of autism. And when I started in this field, autism was a very rare condition, one child in 2,500. It now sits about 1 in 68, and so the field has changed dramatically in the 30 years that I've been in it. My passion, many years ago, one of the first workshops I went to on autism, the gentleman said that be careful working with kids with autism, they're addictive, and 30 years later I would agree. I think we all benefit from treating those with autism because it's such a treatable condition, and many kids with autism end up doing well in their lives, and many become very important contributing members to society. One of the really big forces in the autism field over the last number of years is families who have embraced an applied behavior analysis or ABA approach to intervening with their kids, and their kids have done very well with this intervention. Lots of the kids have gone on to live independent and productive lives. There are some kids that do need some support in their adult years, and we're excited about a new project happening in BC where we have developed ABA teaching homes, or homes that use the ABA model of intervention and therapy and continue that therapy through the young adult and adult years. When we look at the situation in BC and across Canada right now in the autism field, what we find is that every province is essentially doing their own thing. We don't have a standard that applies across Canada. We don't really have any federal leadership that will help raise the bar in terms of what Canadian citizens, all Canadian citizens, can expect in terms of autism intervention. BC has been one of the early provinces to step forward and to provide intervention before other provinces did. BC can be proud about that, but we also have a level of funding that doesn't by any ways meet the needs for most individuals with autism, and so we could do better. If I was in charge, what would I do for autism treatment? Well, I think first and foremost, one of the most frustrating things for those of us in the field is delays, waiting, either waiting for diagnosis, waiting to find the right consultant, waiting to assemble a team to work with the child, waiting for the appropriate services, other health services, speech and language, OT, whatever other kinds of services a child needs. There's usually waits for all of these, and it's extremely frustrating because we know that early and intensive intervention is what produces best outcomes. So time is of essence, and that's probably the most frustrating thing. If I was in charge, I would try to do away with waiting lists in all of those areas, that all kids are entitled to an intensive, quality level of intervention. And at the end of the day, that saves society a fortune. We know that the lifetime costs for a child with autism are $3.2 million across a lifetime. If you add in the impact of their loss of income, the expenses of caring for that individual, and the impact on the family. So we know that good intervention saves money in the long run. In the more remote communities, if there is a will, there's a way. That families who want to get help for their kids, particularly if those families band together in any way at all, the professional community is very receptive, and the professionals will make their way to the smaller communities. And in fact, many communities across BC right now are being served by professionals who come in, see a number of children within that community. They may not live there, but they're providing good quality help there.